So colleagues, good morning, good afternoon, good evening. You are cordially and warmly welcomed to this partnerships exchange as part of the ECOSOC Partnership Forum. Today's session is an incredible one given what we all on our planet have gone through over the last almost 2 years. The COVID-19 pandemic, which has underscored how important it is for us to work together, how important global collaboration and effective partnerships are to solve not only the issues of the pandemic, but so many more. And today's session is really about capturing so many valuable lessons that were often built as we were driving a very, very bumpy road, and we are still on as we work through the next stages of COVID. We're looking today specifically at multi-stakeholder collaborations and how they have been key mechanisms to tackle the challenges of COVID-19, but also how they're essential as we look to build more sustainable, resilient, and inclusive societies going forward. So in a sense, it's trying to look beyond the challenges that the pandemic put in front of us and really looking forward to accelerate, of course, not only the global response to COVID-19, but of course to the 2030 agenda. I'm delighted to share that we are featuring speakers, experts in their fields who can share firsthand experiences and lessons learned in building and managing those partnerships and what they did during the pandemic, and now how they're going to help all of us think about, consider, reflect upon how we can now take those lessons as we look at other urgent global challenges, climate change, and of course, acceleration towards the SDGs. My name is Lisa Kerbiel. I'm head of the Joint SDG Fund Secretariat at the United Nations, and I'm really honored to serve as the moderator today. We'll be beginning with a keynote address from Dr. David Nabarro, and then we'll have a presentation from colleagues at Newcastle University, and then finally a star-studded panel of speakers who will really give us everything from private sector to multilateral to academic to civil society perspectives on what's really needed going forward. So without further ado, I'd love to just take a moment to introduce our keynote speaker. Dr. Nabarro is currently co-director and chair of global health at the Institute of Global Health Innovation at the Imperial College in London. He's also strategic director of the Swiss-based social enterprise 4SD, which is Skills, Systems, and Synergies for Sustainable Development, which was established in 2017, which does training and mentoring of leaders for sustainable development. Since 2018, David has curated the Food Systems Dialogue as a contribution to the transformation of food systems, and that's involved more than 1,700 leaders in 29 locations over the last 18 months. And of course, from March 2020, David has been appointed Special Envoy of the WHO Director General on COVID-19. So David, I hand over to you for the keynote. Thank you so much.
Well, thank you, Lisa, and hello to everybody. I'm talking to you from Geneva in Switzerland, and I'm actually totally delighted to be back here in the ECOSOC format and focusing on partnerships, because it's something that is so dear to my heart and so relevant in the work that we're doing in relation to COVID-19. Now, I'm going to just give you the 7 headings that I will refer to as I make this talk. I'm going to say, first of all, the pandemic is continuing and the virus is here to stay. I'm going to focus on the fact that it affects all sectors. And thirdly, that it challenges decision makers. It's a tough one. Fourth, I'm going to stress that collective responses are those which are most powerful. Fifth, that partnering is the best way to get to greater effectiveness. But number 6, if we want to partner, it helps if we are authentic. And 7, I will look ahead with hope, building on some of what we're learning about partnership. Now, I will make each of these 7 points illustrated by a small slide, a PowerPoint. And I'm also very keen to be keeping in touch with all of you if you wish. if you want to follow up on any of these things, and I will be sure to put an email in the chat in case it's helpful to you, an email address. So let's go to the next slide, please. I want to give you now the daily epidemic curve that the WHO produces to tell us what's happening with COVID. Its shape has changed an awful lot in the last 4 months. And the thing I want to start by saying is the COVID-19 pandemic continues. It's very strong. It's nowhere near its end. Even the last 24 hours, somewhere in the region of 2.5 million new confirmed cases reported to the World Health Organization, and about 9,300 people dying as a result of the virus. We can't, I think, say that this means that we're reaching the end, as I read in some newspapers. No, we are still very much mid-pandemic. There are still an awful lot of people falling ill each day, and unfortunately, far too many people dying. And these are no doubt underestimates. After all of us know that it's very hard for people these days to get a PCR test to confirm whether or not they've got COVID. So almost certainly there are many more people getting sick in the last 24 hours. Nowhere near the end, still continuing is my first point. Second point, next slide, please. Now, the virus has impacts on all sectors. Of course, hospitals are overloaded, health systems are impacted, but anyone who has children going to school in a place where there is a lot of COVID right now knows that this is impacting on the education sector very badly. And our friends in the United Nations Children's Fund have pointed out that it's been an absolute crisis for child education. But then if you go to the Food and Agriculture Organization, they tell you that food systems are being damaged and malnutrition has increased. And then talk to any company anywhere in the world and they'll say supply chains are being disrupted and logistics are not working. And the only way to tackle COVID and its impact on people is a whole of society response based totally on the Sustainable Development Agenda and supported by effective coordination within countries and between countries. There's no other way. Next slide, please. Thank you. But it's not that easy. Decision makers find the problems caused by the virus that causes COVID to be very challenging. First of all, it spreads in a very dynamic way. You see swirls of disease. You see spikes as cases increase. And then occasionally you see big surges, like we have seen in places with a lot of people not able to get to hospital and getting seriously ill and dying because they lack oxygen. This is a very unusual and difficult pattern of disease. And in fact, we've not had a coronavirus pandemic in at least 100 years. And the pattern of disease is unusual, but it does more than just tell us who's sick. It also reveals gaps in the systems in society, in particular because it reveals the challenges faced by poor and disadvantaged people everywhere. Of course, the way we need to contain the disease is through public health measures, but there's still remarkable disagreement about the right measures to put in place in different phases of the pandemic. We in the World Health Organization believe that these measures should be applied in ways that are based on risk, with collective action for the good of all, based on partnering, which works really well. But there is a narrative going around that, in fact, what we want to do is to restrict people but what actually matters nowadays is liberty. And there's a false dichotomy emerging, particularly in some governments, that basically it's a choice between restrictions and liberty. And we don't believe that's right. We think that good health results from action to keep the virus at bay, and that is done through working together. Next slide, please. The virus is actually so challenging that the evidence everywhere is that working together leads to more powerful responses than working individually. Quite simply, individual states or provinces working separately are going to find it very difficult to get on top of the virus, but when they work together, it's a good result. Businesses working separately from each other, much less satisfactory than if they work together with common codes of practice. And in fact, more generally, if there are collective responses, they are more likely to work if there are shared values and an agreed purpose, a common narrative, as well as functioning networks of people with connections between them that are nurtured based on mutual respect and at local, national, and global levels. Now, I know that that's not what we're seeing in the majority of responses in the international arena, where there seems to be disrespect, where there's not a common narrative, and where networks are not working well. But within the WHO, we've got many more examples of successful working together than of people not doing so. It's just that they don't get publicized in the newspapers very much. So let's focus on these good, virtuous, collective approaches. Next slide, please. First of all, partnering does lead to more effective action. When I was introduced just now, there was a description of some work that I've been doing to stimulate multiple perspectives coming through diverse, inclusive dialogues on food systems within the context of COVID. It's been incredibly positive and inspiring, with the unleashing of much energy as different stakeholders come together and consider the future of food systems in the context of COVID as part of the United Nations Secretary General Summit on the future of food systems. But we've seen the same with the regional focus on COVID inequity between the African Union and the African Centers for Disease Control. We've seen neighborhood health watches throughout Asia, Africa, the Middle East and Latin America, as well as the Caribbean and other island states, showing that if you have a neighborhood health watch, that greatly reduces suffering. And we've seen enormous international efforts partnering for equity through the Access to COVID Tools and COVAX program. Next slide, please. And what we've learned through our examination of partnering is that to get there, being authentic makes a difference. And there are 5 characteristics that we see are helpful for partnerships. First of all, recognize that all of humanity is hurting, especially those with less power. Don't try to pit a situation where countries fight each other. Display humility in the face of this virus because so much is not known. Adopt a holistic systems approach and be honest in words and actions, and be hopeful when hope is justified. This authenticity, next slide please, makes a huge difference in partnering. Looking ahead, we will need to do more. The pandemic will be active into this year and beyond. A collectively led response encourages the partnership spirit, and fighting between leaders, especially when it is politicized, undermines it. Potential partners can then coalesce in a context of diversity and inclusion, which is the secret to partnerships that then can emerge that are based on authenticity, transparency, and giving agency to all. Next slide, please. And so some final thoughts. It's the virus that is the problem, and it's people who are the solution. And transmission doesn't start and end in capital cities. It starts and ends in communities. And if leaders are trusted by setting a good example, then their people feel empowered to partner. Thank you for the chance to share these thoughts, and I look forward to the next part of the session, particularly the panel and the presentation.
Dr. Navarro, thank you so much for that inspiring, somewhat sobering, but yet, yeah, I think a way for us all to really reflect on what this panel is about and what the world continues to go through, as you so properly point out. You know, bringing authenticity to everything we do, and that sensitivity and humility, I think, is something we all need to remind ourselves. So really, thank you for those, yeah, quite powerful reflections. I'm now delighted, colleagues, to move into the next part of the program, where we actually have two colleagues from Newcastle University, Dr. Graham Long and Dr. Emily Clow. Doctors Long and Clow have conducted a survey through Newcastle University to help understand how voluntary initiatives and partnerships are supporting implementation of the SDGs, what challenges they face, and the kinds of support that have proved what can be most effective. So handing over to you for your presentation. Thank you.
Thank you so much, Lisa. Okay. So thank you. Today we'll be talking, as Lisa mentioned, we'll be presenting primarily the results from a very recent survey of partnerships that we did. The survey was distributed to all registered partnerships on the UN's SDG platform on the 16th of December, 2021 by colleagues at UNDESA, with a closing date of the 14th of January, 2022. So it really is very fresh data. We had about 900 responses in total, many of them from NGOs, but also with a good variety of other types of partners as well. The survey was available in English, Spanish, and French. So we had two academic teams contributing to developing the survey. Graham and I, my colleague Graham and I, are part of a team at Newcastle University led by Catherine Rettig and funded by the British Academy that's looking at the role of partnership and just transitions in the forestry sector. And the other team is led by Professor Karin Backstrand of Stockholm University, and it's funded by Formas, the Swedish Research Council on Sustainable Development. That project examines synergies and effectiveness of SDG multi-stakeholder partnerships. In addition, UNDESA, colleagues from UNDESA and the Partnerships Initiative also contributed questions and some really helpful feedback. So thank you for that. Having said all of that about the new survey, the first slide I'm presenting is actually from a survey on the impacts of COVID-19 on stakeholder engagement that Graham and I completed about a year ago. So the full report on that is on UNDESA's website if you're interested. We asked a few questions about partnerships on that survey. The one that we wanted to highlight here was about partnerships that were formed in response to COVID. So as you can see from this graph, it appears that new partnerships reflect the priorities you might expect. So a lot of emphasis on new partnerships around health services, digital services, and education services. But there were kind of a couple of surprises here as well, such as the very low number of partnerships committed to expanding access to green space at a time when green space was in very high demand. One thing that we were particularly interested in is the kinds of goals that partnerships were focusing on. So what we've done here is compared data from the partnerships registry in 2019, so that's in green in this graph, and compared it to our 21-22 survey results. So we did another project in 2019 where we analyzed the partnerships data. So this is slightly different kinds of data that we're comparing here, but we still thought it was an interesting to sort of see this shift over time. First, it's worth noting that in 2019, partnerships chose on average 2.5 goals they were working on, while in our most recent survey results, partnerships chose on average 4 goals that they were working on. So we thought that was really interesting and a really encouraging sign in terms of partnerships maybe thinking more broadly about the SDGs and thinking about the SDGs in a more integrated fashion. So sort of thinking about potential sort of synergies there. We found that the partnerships in our most recent survey were addressing particularly goals 3 on health, goal 4 on education, and goal 13 on climate change in particularly large numbers, which is kind of what you might expect given obviously the current COVID context and of course COP26. It's also quite heartening to see how many said that they were working on goal 17, partnerships for the goals. We also asked about the regions that partners were operating in. So respondents could choose as many regions as they liked. It's important to note here that this isn't necessarily where the partnership is based. This is where these partners had operations. We found a lot of partnerships had operations across the global south, especially in sub-Saharan Africa and South and Southeast Asia, as you can see here. We found that particularly interesting in light of some things that David was saying about the health of partnerships in lower and middle income countries. We also think it's worth noting that about 1/3 of our respondents said that they operated globally. So they were kind of operating in a number of different countries. We also asked partnerships who they'd engaged with, and you can see the responses here. So we've highlighted the institutional groups, the groups we thought of as sort of more institutional, such as governments and business, in red, and the groups we think of as kind of the more left behind groups or potentially marginalized groups are in yellow. Given the challenges of engaging with stakeholders during the last 2 years, we think there's an encouraging degree of engagement with, with a variety of stakeholders. It's worth bearing in mind as well that, that the survey kind of picked up on a wide variety of projects, and potentially not all projects are going to need to engage with all stakeholders. So depending on their locations, whether it's urban or rural, and the kind of work that they're doing, maybe you wouldn't see engagement with, you know, every stakeholder on the list. That said, we also did notice a real significant difference between the groups at the top, children and youth and women. So over 60% of partnerships that they were engaging with those groups, and groups more towards the bottom of our graph. So from in particular, maybe homeless people and slum dwellers, migrants and displaced persons, ethnic minorities, where it's about 20% of partnerships that that engaged with those. So almost a 3-fold difference. So we would just sort of think it's worth maybe reflecting on why we see those differences and whether there's something that can be done there. I'll turn over to Graham.
So thank you, Emily, everyone. Hello, just to kind of take you through a final few findings. So we also asked questions about challenges for partnerships, both kind of external and internal ones. So in terms of external challenges, finance always comes out in these kinds of surveys and analyses as the most significant challenge, and there's no change here. So we're looking especially at kind of the size of the dark blue area for each of these, and then the green area being kind of a small challenge. So finance comes out as the most significant one. It's interesting perhaps that the wider context, which I think tracks a broad range of COVID impacts, and also the participation of marginalized groups come out prominently, especially in terms of the blue area, kind of the area that being seen as a significant challenge. Next slide, please, Emily. We also asked about challenges within partnerships, and perhaps unsurprisingly, insufficient commitment is seen as the most serious challenge to partnership. Again, looking at kind of the combined area and the individual area of kind of the deep sort of maroon and the red there. I think it's worth noting perhaps that respondents see lots of small or significant internal challenges. So over 70% of respondents on each of these elements thought it was some kind of challenge for their organization. You know, partnerships obviously kind of aren't challenge free. And it's also perhaps interesting, and we're not going to try and flick back between this slide and the previous slide, but we obviously there's some difficulties in kind of comparing the two, but it seems to be the case that respondents find the internal challenges more serious on balance than the external challenges, which is, I think, is quite an interesting sort of challenging thought. Next slide, please, Emily. So an important question, and something that's kind of prominent in the debates around partnerships, is the kind of added value that partnership yields. And I think this is kind of an interesting question that we posed in the survey. So as you can see from the graph to the right here, learning and innovation is the most commonly identified added value. I think that's kind of expected and not unwelcome. But perhaps kind of more encouraging is the finding on innovation that a very large number of these partnerships, kind of over 50%, kind of testify that they were generating innovative or new solutions from these partnerships. That was where it was adding the value. I think it's perhaps quite a very significant finding. I guess there's less evidence of other kinds of transformative or integrative impacts. So sometimes we look for partnerships to operate at a larger scale or produce more holistic action or kind of leverage more synergies across more SDGs and these kinds of things. And as you can see, they come further down the list here of the kinds of numbers of partnerships who testify to those kinds of outputs added from partnership. I think the overall question for this kind of set of results is whether these results are kind of from which angle do we think them to be kind of good or bad? What's the expectation here for quite how much partnerships are doing? It's clear that partnerships are adding something. And I guess the question is, partly, is that in line with what we'd expect? Or if not, then how could they be made more effective? Thanks, Emily. Next slide, please. So just in two closing slides, we asked, with Karen Backstrand's help, some questions about synergies and trade-offs. So 83% of our respondents said that their partnerships pursued synergies between the SDGs. I guess that's a welcome. We need to do a bit more kind of analysis and digging on these results, but you can see here that poverty, education, and climate action all come out high in terms of the proportion of people who saw synergies in these areas, but we can't say whether those are synergies with each other. That's kind of a further level of analysis. And then a final slide on trade-offs, please, Emily. So I think it's quite interesting that only 26% of respondents saw trade-offs between the SDGs that they were working on. I think there are perhaps kind of a few explanations for that. It might be, so a lot of kind of academic work looks at identifying trade-offs between SDGs, but it might just be that the partnerships just aren't experiencing that. So, or it might be that partnerships are working on clusters of SDGs that are kind of synergistic, and so they've deliberately chosen to avoid situations in which the SDGs they work on are kind of traded off. There's an interesting further analysis to be done there. And I guess, interestingly, again, climate change is identified as a prominent area for partnerships, but there's also the goal most frequently identified as being involved in these trade-offs. Okay, so that's the end of the slide presentation. Thanks so much for listening. That's just some key findings. Hopefully there'll be a bit more of a report coming in the future.
Thank you so much, Emily and Graham. Really appreciate that. Looking at really the inside perceptions as well of both the external dynamics, but also what's happening within organizations that can make partnerships so challenging. So a lot of learning, and it looks like a lot of overcoming those challenges for the success in the COVID-19 response. Thank you so much. Colleagues, we're now moving into our panel discussion. And again, an incredible group of discussants. And we'll be starting off with Ms. Sanda Odhiambo, who is the CEO and Executive Director of the United Nations Global Compact. Sanda works with more than 15,000 companies around the world as the ED of UN Global Compact, and that's all to advance the SDGs. And every 2 years, the Global Compact prepares a report of the Secretary General to the General Assembly to take stock of global trends, influencing partnerships, and issues recommendations to better harness the potential of cooperation between the UN and so many partners around the world. And Sanda, your team just published its latest version a few months ago. So we'd love to hear from you. First of all, welcome, and thank you for joining us. But we'd love to hear from you. What does the latest report tell us about the evolving state of UN business partnerships in light of the pandemic and other significant global challenges? Sanda, over to you.
Great, thank you, Lisa, and really greetings to all of you who are gathered here today. It's really great to have the opportunity to share our experience around partnerships from the Global Compact perspective. But first, let me say, I think David's presentation really does highlight a lot of really key basic and fundamental elements of partnerships that sometimes we, don't always bring to the fore, as we focus on the contracting and the outcomes, things like authenticity, things like honesty, things like, just focusing on effectiveness. And I think those really underpin a lot of what I'm about to say. So David, thank you for that immense clarity on what is really important in terms of partnerships. So, as we know, the UN obviously works tirelessly to tackle the world's greatest challenges. And, what has happened is that the size, the scope, the shape of these challenges continues to change over time. And what's evident is that, no one sector, no one entity can really address these challenges, and partnerships are now more than ever critical for this. The pandemic, of course, highlights how important partnerships have been. We've often used the term partnerships unusual in the pandemic because a lot of new configurations, a lot of rapid configurations have come along. And partnerships in the pandemic have been a really good tool for recovery, for response, and really putting us back on track for the SDGs. And partnerships have been rapid and, have been able to keep at pace to some extent with the changing dynamics. So, as you say, Lisa, we issue a report every 2 years to look at, partnerships within the UN system. That report is, formally titled, Enhanced Cooperation Between the UN and All Relevant Partners, in particular the private sector. And we do this on behalf of the Secretary General. And we look at global trends which influence UN partnerships, and we issue recommendations as to how we can better harness the potential of partnerships between the UN and its partners. And I just want to share a few highlights, and I'll talk about them in sort of some subtopic headline points. So first of all, what we find around what is changing. Throughout the UN system, partnerships with external actors, in particular the private sector, are evolving. We're seeing a shift towards more deeper and more strategic collaboration, moving away from more tactical ones. And we're seeing a keen focus on innovation, scalability, and impact. And I think obviously the challenge of the pandemic have made us want to take that look. Particularly in the pandemic, partnerships have been more agile, and we have been able to progress faster in terms of collaborating on this. One practical example, UNDP, ICC, and the Global Compact joined forces to support SMEs recover from the pandemic. But what have been the enabling circumstances for change? I think, part of this is going back a couple of years. The reform within the UN system has also helped make it a more effective partner, placing greater emphasis on this focus on strategic and longer term collaboration, especially at the country level. But what we know is there's still so much more untapped potential for this to continue to evolve. And we see cases where it works extremely well and cases where we can definitely do more and do better. But what is clear is the UN can definitely leverage its convening power to be able to drive and secure platforms where partners can come together. Lots of opportunities still lie ahead. And I think in this space where we are with flexibility, with the embracing of digital and technology, I think taking the opportunity to translate where we are in this new world of work, in this new world of life, to look at how digital tools can help us convene, collaborate, and cooperate, I think will definitely provide a new and a more effective and efficient platform for stakeholder engagement and different types of partnerships, particularly with the private sector, who tends to be more agile, more robust, and perhaps quicker to view and seize partnership opportunities. In many instances, I think related to the pandemic, the UN was pushed to adapt procedures for partnerships that were new, that were more flexible, and I think that has been taken on board quite well. Numerous UN partnership experts that we interviewed said that their organizations had attempted to fast track partnership vetting, given the urgency of the pandemic, so that they could support new opportunities and be able to participate in much needed pandemic response. At the country level, public-private partnerships were truly an important pillar of many of the socioeconomic responses that we saw, guided by UN country teams. On the other side, though, looking from the outside in, and if I could speak a little bit about our private sector business participants, they have also demonstrated, I think, growing openness to pre-competitive collaboration. I think we all saw that. Brands that were previously in competition came together to respond to the pandemic, particularly in areas such as vaccine research and vaccine development. We saw brands come together, for distribution and supply chain issues. We saw a lot of collaboration, but the truth is, and David has highlighted this, access and equity still remains a huge challenge. Those disparities, as we see between the global north and the global south, continue to remain, and they're glaring and unconscionable. And our hope is that the innovation, the momentum, and the agility of partnerships will continue, because there is no way that we can continue to respond to the pandemic without these partnerships. And it is really imperative that we're able to maintain that momentum. I think, as we said, the early days of the pandemic had these massive expressions of goodwill, of funding, of financing, and a desire to cooperate. But as we see some countries say that they're, done with COVID, or they've attained, significant vaccination rates, it does not mean that these partnerships need to fall silent to the rest of the world that doesn't have access. So for us, that is really important. Continued forced dichotomies. Thank you, David, for highlighting them. Restriction and liberties. Saving the economy versus saving lives. I mean, these things can coexist. I think it is very important, and the private sector has been, strong advocates for this. So, from the Global Compact side and from our partners, we think it's very important to make sure that within the UN, and certainly working with the private sector, we're able to promote avenues that we can continuously partner with businesses, with the UN, with civil society in ways that make a lot of sense to continue to respond to the COVID pandemic. I just want to tie up with David's point that the pandemic is still with us, and we must continue, perhaps now more than ever, to continue to innovate and meet the needs of a fast changing pandemic that still lies ahead of us. Thank you very much.
Sanda, thank you so much. And I'm sure many of our listeners are looking forward to reading the report. And I'm sure we can put the link to that both in the chat, and I'm sure it's on your website. But I think, looking for the way to maintain that momentum. You emphasized the momentum at the beginning, in 2020. Well, here we are in February 2022. The momentum is even more needed because we're at risk of leaving so many behind. And I think that strategic leadership, that authenticity, all the things that you and David brought out so far are so critical. So thank you so much. I'm sure there'll be questions for you as we move through the program. I'm now, colleagues, moving on to our next esteemed speaker, which is Ms. Sasha Gavizon, who is Executive Director of Women Engage for a Common Future. Sasha represents the women's major group at the UN, which ensures participation of women's organizations in the Sustainable Development Goals policy processes. She's Executive Director of Women Engage for a Common Future, which is an international network of women's rights and sustainable development organizations from over 50 countries. And Sasha also leads their flagship program entitled Women 2030. So Sasha, a warm welcome to you. Thank you so much for joining us, and delighted to really shine a light on this perspective, right? All these organizations you represent and what they've seen in the last few years. Over to you. Thank you.
Thank you very much, Lisa, and hello everybody, all the panelists and all the participants. I'm very glad that I'm able to join you for this exchange, and greetings from Nairobi. Like Florence, who will speak after me, I am currently in Kenya, and I had to stay a bit longer than foreseen due to COVID. So I'm feeling the pandemic in my direct partnership project at the moment. But I'm very well looked after. As you said, I have been one of the organizing partners of the Women's Major Group in the process leading up to the SDG decision in 2015. And since then, these last 7 years, we really have seen an increase of the challenges, climate change, conflict, and now already 2 years of the COVID-19 pandemic. And it's a really important part of our work to make sure that the women, through the Women's Major Group, which is a recognized space for civil society organizations to engage in 2030 agenda, that the voices are heard and that women are at the decision-making table. And with us, we have 20 other major groups and stakeholder groups that represent indigenous peoples, youth, the LGBTQI community, and regional groups from Asia Pacific and elsewhere. So the space provided by the UN to share our proposals and positions and to bring the voices of local feminist and women's groups have been very important, but has been closed down quite a lot during the COVID pandemic. But not entirely. For example, one good example is that we cooperate in a partnership with UN Climate Technology Center and Network in identifying amazing local climate solutions that are at the same time socially inclusive and strengthen gender equality and are good for the climate. And we've been able to continue these partnerships in 15 countries with local groups despite the pandemic, investing in their capacities and hardware and internet access. And at the last climate COPs, the conferences of parties in Madrid and in Glasgow, which were fortunately still in-person events, these local women and men, leaders of these climate solutions, were able to present their programs to governments and to other stakeholders. For example, a wonderful program in Cameroon protecting community forest, having women join the forest governance bodies, which before they did not, and engaging in bee and honey value chains, and engaging young women particularly, which has really helped to stop early marriages. So you have an entire combination of inclusion, climate protection, forest protection, and local income generation. And there are many more great climate solutions. And as a result of the visibility for these type of local projects, they were able to increase their financial support with 74% and to enhance their activities. So that's a really great program. And then it was linked to the Generation Equality Forum, which was initiated by UN Women, where there is now an action coalition for feminist climate action. And here you have co-leadership by civil society organizations. And we have helped to launch a scale-up fund for gender just climate solutions. It's a small fund, but all of this happened during the pandemic. And it's very necessary because, as we heard also before, the pandemic is, of course, limiting funding for civil society activities, specifically also for women's rights and feminist organizations. Currently, I'm in another partnership project with local feminist and environmental organizations here in Kenya. And this is a partnership with the UN Chemicals Convention Secretariat, where we identify and promote good practices in dealing with harmful chemicals and waste. I don't know if you've ever been to Dandora, which is the biggest waste dump in Nairobi, but it's very scary. It is a huge mountain of burning plastic and e-waste, and now also pandemic protection gear waste and masks. And these fumes are, producing furanes and dioxins, which are supposed to be phased out globally because they are so dangerous. And many of the waste pickers working there are men, but especially also women and even children. And Kenya really wants to do something about that because they have in their constitution the gender equality principle. All policies aim to promote gender equality and to specifically improve the situation of groups which have been traditionally left behind or discriminated. So with our project, we see that there is a lot of interest and support to look at solutions. But so far, what we also saw is that many of the governments and authorities and local authorities were not considering women and feminist organizations as partners. Topics like climate or chemicals or waste are seen as very technical, and often the local women and feminist organizations are overlooked, despite the fact that many of the small farmers or the farm workers in the flower sector, which is very big here, are women, and they are very much exposed to hazardous chemicals and carry the burden when their families fall ill from these chemicals. There is a main focus in partnerships for this sector on the private sector, and particularly government is looking at the corporate private sector, also hoping for responsibility taken, and they call it extended producer responsibility. But unfortunately, very little of this extended producer responsibility has managed to reduce the pollution and the contamination. So we, as the Women's Major Group, see that the corporate private sector, who have created a lot of the mess we are now in with climate and chemicals and waste, is given the hand for the partnerships, whereas maybe there would be better partners. And we believe that the multilateralism space should not be dominated by multilateral and multinational corporations, but really more by the local actors. And we would really like to have more accountability also in the cooperation and partnerships with the private sector, especially the corporate private sector. If you look at the Secretary General's Our Common Agenda, he also puts a lot of hope in the private sector funding for the implementation of the 2030 Agenda, directly from corporations or from philanthropic foundations. And we really are looking for stronger criteria to avoid conflicts of interest. And I'm almost done, but I would like to give the example again of the petrochemical sector. You probably don't know that an estimated 385 million women, men, and children get poisoned each year from pesticides. Many of these pesticides have been banned in the global north, but due to double standards, some of our corporations still continue to export banned pesticides to the global south. For example, we have an office in Germany, and Germany has been exporting 9 highly hazardous pesticides, which they banned themselves, to countries in the global south. Alternatives to these highly hazardous chemicals from the petrochemical industry do exist. I have just visited here in Kenya amazing, innovative companies, many women-led companies that have developed plant-based alternatives, biopesticides that are highly efficient and which the Pesticide Control Board has even approved because they are efficient and they have the additional benefits of being much less risky for the health of farmers and local communities whose water get polluted, etc. So when we build partnerships to build forward better from the COVID pandemic, let's make sure that we favor partnerships also with local communities, with indigenous people, with feminist and women's rights organizations and other civil society. And let's have the right criteria so that when we involve corporate polluters, it's not to whitewash their image, but because they're really at the core making a change towards a green and inclusive business model. So I know that Sanda has just given a really nice presentation from the UN Global Compact, and a lot of great work is being done, but we believe more should be done to really make sure that we have the right partners for building forwards from the COVID pandemic. Thank you very much.
Sasha, thank you so much. And thank you for those very powerful examples from the community level and the impact that it's having on our communities every day. I think your call for action is well heard and is shared by us all. And I think, trying to look at the way that we can really all focus on accountability is a challenge that we should all strive to meet, certainly as we try to build forward together. So thank you so much. I'm delighted to move on to our next panelist, Mr. Philip Schoenrock, who is director of CEPE. And Philip, you co-founded the COVID-19 Data and Innovation Center at CEPE, which is a collaborative data platform designed to inform pandemic responses and recovery strategies. So we'd love to hear about the platform, how you helped develop it and what you've learned from it, but also, was there anything unique about COVID and was there anything different when so much was different, but anything specific that you'd love to share with the audience? Thank you so much. Over to you.
Yes, Lisa, good morning to everyone. It is good to see you from Cali, Colombia, and I believe everything is right now very unique and different of what we have seen. And as you mentioned, I was invited today to present my ideas on some specific questions, which in order to do so, I would like to share some experience I have encountered with my colleagues during this last couple of months or now almost 2 years, maneuvering through this very unknown territory. So what were the enabling conditions that led to be a successful and rapid partnership building during COVID-19? And Lisa, I believe, first of all, we need to look at what are the scenarios for the partnerships that were built during the pandemic. And I would segment it in 3 parts or scenarios. The first, it's the analytical part. It includes the data, the research, analysis, and advice that the different stakeholders can give in order to build forward better. The second one, it's operational. And it's the program delivery and support that the organizations can give, and specifically the work with partnerships with the UN based on the issue-based coalitions, which are a clear example that has worked especially on the regional level very well during the last couple of months. And the third scenario, it's the brokering. And that's bringing people and organizations together for a common purpose like building forward better. So going back to the question, let me take a very hard stop here and get back to the basics. How to be actually an effective driver of action, create innovation, within weeks, we would have to say, and navigate a Southern-based think tank, like in our case, through a pandemic that within days changed our modus operandi and put many colleagues and also friends organizations in a critical situation of existence. So 5 ideas to that question. First of all, we believe we need to find enablers in times of crisis. That means we need to have a strong team, but we also need funders, and we need an enabling environment specifically where we can operate. That means the laws, that means the access of information, and also the freedom to do our work in a way that it is effective, transparent, and also has the impact. The second part, it might be a little bit biased, but I do believe running a data-driven think tank that we need to invest in data skills in order to understand and not only have access to data, but use it more wisely in the planning and implementation in building forward better. The third point or idea, it's experiment and risk. We need, as stakeholders, and especially from the civil society, need to be able to have a laboratory of ideas and going back and forth and really experimenting and seeing what works and what does not work. We cannot go and funders cannot expect that we can do everything perfectly in a situation like this. So we need to have the space to adjust. And last but not least, the 2 points of co-creation and building a stronger community around building forward better and communicate and transfer of the knowledge. Those are all points that I believe we have heard very much in other scenarios, so they're no rocket science. So I actually wanted to go then much deeper in what lessons can be learned to speed up the future of partnering efforts. During the last 6 years, my colleagues at CEPEI have been studying the voluntary national reviews submitted by Latin American and Caribbean countries to the HFPF. And some of the findings are quite striking when we look at partnerships to build forward better. Simply one example to highlight here. Out of the 44 VNRs that we analyzed, 38 underlined the multi-stakeholder approach to the 2030 implementation and follow-up, which is a critical baseline, and this recognition, it's very important. However, and this is the important part, when we move towards a more detailed analysis, we find that what actually looks like a wide recognition of the stakeholders' role in the SDG implementation, it's not necessarily reflected in the critical fields of partnership building and sustainability. And once again, giving an example to close here on the data-related part. Considering the lack of available data to track the SDGs, which is a huge problem not only in Latin America and the Caribbean, where we track the VNRs, 26 of those 44 VNRs refers to plans to improve data availability, but only 11 include references to partnerships with non-state actors in this field, which actually means that 33 VNRs out of 44 do not even mention partnerships for data availability improvement. So in order to close, and this was the last question made to us, what was the difference about developing partnerships during COVID-19? I believe absolutely everything, but the big points to close are 5 again. Build strong and inclusive governance structures to build trust, which means enabling environment is the baseline to build partnerships and trust. Evidence, we need to learn and to do better. We need the evidence, and it has to come much faster as we are getting it. Transparency, and this has to be on all sides to hold those in power accountable, but also as stakeholders when we implement and partner with them. the planning. It has to be based in results. So we cannot only say we're going through a pandemic without planning ahead with concrete results in the making, and the impact to leave no one behind. So Lisa, I think I took a little bit more of my 5 minutes, but that's usually because in Latin America and the Caribbean, we use 5 minutes to salute everyone. So I simply tried to speak a little bit faster to bring our ideas forward and simply share those with you. So sorry about taking a little bit more, but it was a good opportunity to be here with you, and I'm open to any questions later on.
Not at all, not at all. Thank you so much for bringing that perspective. And I really liked your reference also to the VNRs, the critical importance for how government is really identifying or not identifying certain gaps in what is needed for the 2030 agenda, and also the mention of non-state actors. We have to be aware of the totality of how COVID-19 has affected us all. And that doesn't know political affiliation, it doesn't know borders, it doesn't know ethnicities, it doesn't know, so many other human identifiers that we've created amongst ourselves. So really valuable perspectives, Philippe. I'm sure there'll be questions as well. And really welcome for you to put your data, any information into the chat for those who want to immediately start checking that out. Delighted now to pass on to Ms. Jenny Ekelund. Jenny is the Director of Green Transition at the Partnering Initiative, and she leads on the development of a rapid partnering protocol at the TPI, building on COVID learning and how it can be applied to climate change. So really exciting pivot now to really understand, are there lessons for how to speed up future partnering? We're hearing so much about establishing trust, all the criteria that we need to really get over some of the frictions or resistance to partnering. So are there lessons there? And are there any that can help us not only as the crisis of COVID continues, but then also into climate change and ocean protection and other areas? So Jenny, delighted, over to you.
Thanks so much, Lisa. And it's a pleasure to be with you all today. Hello from Oxford. It was really fascinating actually listening to the earlier speakers. I was nodding vigorously along, particularly when Graham and his colleague from Newcastle University were talking about how so many partnerships over the last couple of years are starting to have synergies with climate change, and it's really exploded over the last couple of years. So it's been a really interesting time for me. I think it's clear that the pandemic can't be viewed as an isolated occurrence. Rather, it's a symptom of a deeper set of interrelated crises, persistent inequality, rising temperatures, and a general failure to live within planetary boundaries. So as we continue to navigate the pandemic, and as David Nabarro rightly pointed out, we're certainly by no means through it, we're still very much in it. We need to think about how effective partnerships across sectors can help us to ensure that a shift to a just green economy is baked in, and that we really double down on efforts to tackle the climate crisis now, not by 2030, but now. It's a really very small window in which to act. So my focus at the Partnering Initiative has really been on how we can accelerate the climate partnerships that we need across sectors in order to really make progress quickly. Now, something that we've learned at TPI over 20 years of supporting partnerships is that generally partnerships are not a quick business. They do take time, they're not linear, they are iterative, but the truth is we don't have the luxury of that time when it comes to the climate crisis. So you can imagine how interested I was as we started to record testimonies and case studies and experiences from the partnerships that we were supporting during the early stages of the pandemic, to try to understand from what we could learn from them and apply to future climate partnerships. And I just wanted to share 3 specific lessons that came through for us and start to speculate about how these could be useful to us as we tackle the climate crisis. Firstly, it was abundantly clear that a common urgent crisis does make it quicker and easier to develop partnerships. We're astonished at the speed with which some of these were set up. And it might seem obvious, but I think it's worth delving into why. So of those who we worked with who reported having been involved in new partnerships as a result of COVID, almost 80% said that they were quicker to get off the ground compared to previous partnerships. And the reasons that they were cited were a shared sense of urgency gives a laser focus, offers the additional grease and glue and allows the opportunity to find shared agendas. Senior leadership buy-in was much, much easier to find. And there was a willingness to skip, streamline, or postpone internal steps just in order to get it done. And then, interestingly for us, though, it was seen as easier to build trust, or rather trust was seen as less important perhaps, due to the overwhelming need to set these partnerships up. And that got me thinking about what we see in climate partnerships. Trust is absolutely vital. And many of the climate practitioners that I've spoken to in the last month have said how very, very difficult it is to set up a partnership quickly if you're already suffering from a trust deficit. So that really was something that resonated for me. The second lesson that came through was that although COVID-19 saw an upsurge in new partnerships, many of those that were formed actually came off the back of pre-existing relationships and networks. So where some degree of trust was already forged. This was mentioned by numerous practitioners that we spoke to. And I think that was an interesting lesson, because people were saying this really shows how we need to be more connected with other partners and actors, and that gives us readiness to pivot and to address these situations quickly when they come up. And actually the pre-existing partnerships that were most able to pivot and respond to COVID-19 were those built on already strong relationships. Again, it almost sounds obvious when you think about it, but actually I think it just shows how worthwhile it is to invest in building those relationships, building trust in the quieter times, so that you're prepared for when something really happens. And thinking about my work with climate practitioners, something that they have said when thinking about how this process could be sped up is that actually often your climate partnership doesn't need to be created from scratch. Often there's a partnership that's already working on something similar. You could dock onto it and immediately you've cut out an entire phase, which takes an awful lot of time, where you're setting up the nuts and bolts. I thought that was really interesting. And then thirdly, although there were plenty of examples of large global partnerships formed or pivoted in response to COVID-19, the people that we were working with were most enthusiastic about partnerships that proliferated at a local level, indicating how important the local partnering environment is for a flexible, speedy response to crisis. And that's something that, again, resonated with me in relation to climate practitioners, because at the moment there seems to be a disconnect between the grassroots climate movements that we have and the national work that's being done to meet nationally determined contributions, and indeed the international climate targets. I work with a brilliant organisation called Climate 2025, who was on a panel with me earlier today, and they are increasingly looking to support climate movements to partner and to make connections with other organisations working at national and international levels. And I think that's a really interesting development. So, of course, the COVID pandemic was a rapid onset emergency. In some ways, it cannot be compared to the climate crisis, but there are some learnings I think we can take. And as I've spoken to climate practitioners over the last month or so, the greatest need seems to be for fast, accessible funding with greater tolerance for risk that we saw readily available at the beginning of the COVID pandemic. And that requires a change in thinking from funders and a willingness to invest and to take a risk early, thinking that we only have, at best, 5 years, really, to make a change. Thank you. I'll hand back to you, Lisa.
Excellent, Jenny. No, thanks for that. I mean, I think we're all looking for the secret ingredients, right, to how to really, you know, leapfrog ahead with partnerships when we're in such dire situations, and also with the longer journey on the climate change solutions. I liked the way what you were saying about you know, sort of empowerment and using what you have, and I'm connecting that to some of David's opening remarks about humility and about you know, not pretending to have all the answers, because I think in partnerships there is always that risk that we come to the partnership already knowing exactly what we think we want from the other partner. Meanwhile, they might not have that at all. And if we mislabel them, if we give them a label that they don't want, like donor or leader or problem causer, guilty party, then we may already lose a common ground that we need, right? So I think going in open to say we're joining this to find a solution is really really spot on. So I really appreciate that, Jenny. Colleagues, we're moving right along. You know, it's a full agenda with so many great speakers. So I'm going to move very quickly on to Mr. Anthony Gitau. Anthony is the Director for East and West Africa for the Johnson & Johnson Foundation. So warm welcome to you, Anthony. The Johnson & Johnson Foundation really was rapidly changing their practices during COVID-19 to be able to operate faster, to support their partners better. So we'd love to hear a bit about your experience, and also, did you see any elements of an enabling environment that could be something shared and learned by our listeners? Over to you, Anthony.
Well, thank you very much, Lisa. I think just to start with the final part of your question around enabling environment, I think for once we did have something that brought everyone together. And I think everyone prioritized this, right, from government to private sector to the community. And everyone knew that this is important and we needed to come together to do this. So the enabling environment was overwhelmingly positive on this. And I don't think any other crisis has ever brought people together in such a way that, and everyone was very clear on what we wanted to do. And one was to, of course, impact the pandemic, but more was what is going to look like in the future. And so as a collective, I think I really saw that the key learning here is that we need to rally in the same way around the normal times, so that we prepare better for times of pandemic or times of crisis, which unfortunately this crisis really exposed to us, that we in the way we partner and the way we engage, sometimes are not focused on a really systems approach to make a difference, to prepare us for such an event. And that, I think, for me, is one of the key lessons that we learned through this. As a J&J Foundation, I think one thing that we were able to leverage very well is that we are strategically focused on long-term trusted partnerships. And so immediately this happened, it was very easy to plug into our partners. And the first thing we did was to understand what impact this was going to have on current programming. Because as a funder, you shouldn't really tie your partners into straitjackets that really doesn't allow them to maneuver or adjust to a situation. So the first thing was that flexibility and the open conversation to say, okay, we are aware this is going to happen. There are things you can't do that you had planned to do, and how do we leverage that? The second was, because we knew that we would not be able to do some of those things, how do we pivot, right? How do we pivot whatever we had planned to do and quickly adapt our agreements, or even give some trusted leeway to our partners to quickly respond where they needed to, so that we're able to impact the COVID or provide the necessary support to these collectives, and especially to government, to make the right decisions. I think for me, one of the key things was also, when you have that enabling environment, you have government in the lead. And because it's an epidemic and a crisis, sometimes they did not have the right personnel or the right technical team to respond to this, because this is not normal. And so being able to give resources to those funds that are able to put in the right staff to work and support the policy makers to make the right decisions, I think was very critical to how this was approached. And the other component is, and this started about 2 years ago prior to the pandemic, we had started to develop, and the platform's approach for when it comes to community health services or nursing and midwifery is really about bringing stakeholders around the support or strengthening of these frontline health workers, with the objective of ensuring that we are putting them in the center of the solution and really supporting them. And this created collective mutual impact platforms that then spoke with one voice on an issue. And a good example of this was when the ministry wanted to understand how we'll approach community health services within the COVID-19 context, and what will be the role and responsibilities of community health workers. Then the platform that we were working on community health services in Kenya came together and gave a joint position paper. And because we were already used to working together, it was so easy for people to come collectively. No one came in with anything to say, oh, this is what my organization will do, or this is what this partner will do. It was what is the best case scenario for the country when we're looking at community health services. And for me, that I think is really critical, that we start to think that way now before anything like this happens again, so that by the time it happens, we already have the knowledge, the understanding on how to collaborate and come up with one joint position on how to address this issue. Thank you, Lisa.
That was excellent, Anthony. I really appreciated how you kind of took us from the realities within government all the way down to those at the last mile who are in those communities, serving, you know, mothers and families and those who could be left behind. So great response. Also wonderful to hear how Johnson & Johnson really made a point as a foundation, as a donor, to be flexible. We've heard previously in the panel how, you know, if donors don't have a risk-taking appetite, it's very difficult at times to be the problem solver, because you're sort of strapped or you know, limited by, you know, certain templates, certain ways that we do business, right? And I mean, COVID taught us that we have to think different and really act differently. So that was really a great intervention, Anthony. Thank you. Moving on to our next speaker, Mr. Jorge Galeano, Country Director for World Vision in Honduras. Jorge, welcome, and thank you so much for joining us. You bring more than 20 years of experience in social and community development processes, with contributions from the community, municipal, national, regional levels of Latin America. You have a portfolio of 14 countries, and you're currently contributing from executive leadership in the identification and implementation of strategies to reduce violence and build peace in Honduras and Guatemala. And of course, in the process, you're involved in many COVID-19 recovery partnerships that World Vision is a part of. So really delighted to have you, and the floor is yours.
Thank you so much, Lisa. I want to share a little bit about the lessons learned of this process, you know, and this is, you know, going back to the past and try to learn from the past to apply that in the future. So in the very beginning, you know, I'm based in Honduras. I spent half of the time here in Honduras, half of the time in Guatemala. So I lived, you know, the whole pandemic in this process, and still we are, you know, in the middle of the process. And I remember very well since the very beginning when we heard about COVID, you know, in Wuhan and what happened in Italy, we received every day tons of information. And also at the same time, misinformation. You know, I remember the social media. Probably you can remember the scarcity of the toilet paper. You know, as an example, what happened, you know, if we see that right now, it is like a funny thing, but happened. So one of the lessons learned in that is how we can take advantage of the communication process, and social media are playing a critical role right now. And for me, this is something that we as a collective action around the world, we need to take advantage of about social media to educate the people and inform in the proper manner, not create confusion. This is very important. Second point about, I remember very well the governments in here, they try to handle this by themselves at the beginning, you know, the health ministries, the education ministry, but this is something that, you know, overpass the capacity far beyond of the government, you know, and requires global effort. This is a global challenge that requires global efforts, global coordination, global agreement, but local response. This is very important. You know, we heard at the beginning from Mr. David about the local response, which is, you know, fundamental in this process. So the coordination is important to make global, but the response locally. This is another lesson learned from the process. And the third one, it is about the partnering. You know, partnering it is critical. I want to share with you, just in the middle of the pandemic, we were hit by 2 hurricanes, 2 Cat 5 hurricanes here. The shelters were, you know, overcrowded, the people with, just in the middle of the COVID. So it was challenging to support the people in that specific moment, but one of the things was encouraging is all the humanitarian actors were active, working together, speaking each other, coordinating in the different areas, you know, and that was amazing because that allowed us to support the people in the very specific moment they most needed. So coordination is critical, partner is critical, and the lessons learned here is to take also in consideration the non-formal actors. the teachers, the group of women, faith leaders. Just to give an example, they play critical role in support the most needed people in desperation during the hurricanes and at the same time during COVID. So private sector is another key actor, you know, and we saw a lot of solidarity from different stakeholders, not just multilateral donors or us and NGOs, but including people from the community helping each other. So the solution requires all of us. It takes a world to support and to end this situation that we are living right now. So this is part of the lessons learned from the process, and thank you, Lisa, for this opportunity.
No, Jorge, really well articulated. You know, how we've all gone from sort of those first days, lack of information, and then the supply of misinformation, all of these different factors that we've all experienced wherever we were on the planet. It really is a unifying reality that we've all been living through. And I think it's one that we must learn from. And I really appreciate you mentioning that local level, because as much as we know the policies and the influence of government and the global level, it does spread locally, right? It literally spreads person to person. So we also can't underestimate the power of that. So thank you so much. And colleagues, I'm last but not least, our final esteemed panelist for today's panel, Ms. Florence Sevullo, who is country coordinator for the Sustainable Development Goals Kenya Forum. And Florence is a renowned civil society coalition builder, coordinator, campaigner, focused on ending poverty and inequalities in all its forms, and definitely making sure we're leaving no one behind. She's been instrumental in policy advocacy and change, generated research papers and reports, and has coordinated mass citizen mobilization for change. So Florence, delighted to have you here to round out our panel, and then we'll be able to take some questions also from the floor. Florence, over to you.
Thank you very much, Lisa, and to all the organizers. It's a great pleasure to join this panel. And for me, it's just to bring the civil society voices, especially at national level in the Global South. And so I'm greatly honored, and I'll go straight into just a few remarks as this particular meeting focuses on the issues of partnership and, of course, the multi-stakeholder. I believe this is very, very crucial, especially right now within the issues of COVID-19 and also the rebuilding back better. I say this because in our scenario here in Kenya, coming from a civil society coalition on SDGs, for us, what really first and foremost helped in terms of now working together during the pandemic was the relationships that had been established there before. And so it was easy because we could now, for example, get into some of these national committees, but also the government and other stakeholders recognized civil society role in terms of service provision, in terms our role as a watchdog, advocacy, and so forth. And so I know a lot of parts of the world, there was, limitation in terms of civic space, but also I believe there was also some new civic spaces that were developed during this particular period. And most of this was on social movement, cooperation in terms of health, social, economic, and service provision at country level, even at subnational level. And so for us, we were involved as different civil society organizations to do that. Of course, I'm not saying that everything was rosy. It was very, very hard work in terms of just ensuring that some of these emerging issues, like, of course, gender-based violence, there's a lot of, teenage pregnancies, there's a lot of, lost livelihoods. And so for the very first time, our population has gone, deep into poverty. And so just how to come up with solutions, how to cushion communities that are really, really experiencing climate change, but also experiencing lost livelihoods and so forth. And so for us, the 17 SDGs, for example, were at play during the COVID pandemic. And so Kenya's approach of, just the whole of government and the whole of society approach, of course, enabled, for us as civil society organizations to, of course, fight for space within national processes. And so it's been encouraging to see that, but also, of course, not everything worked according to some of the things that civil society has been championing. And anyway, it's also been positive to see a lot of good that has been achieved during these partnerships. And as I said before, I think for us, one of the lessons learned is partnerships, while they're built, initially during crisis, you are able to capitalize on those partnerships. And so for us, that was one of the things that we managed. And so maybe just going deep into this particular questions of lessons learned to speed up future partnership efforts. I'd say the first one for us was implementation of major shifts in policy and practice. Of course, we realized a lot of our policies had gaps, and we needed to work towards just meeting some of these gaps. And so there's been a lot of just how do we ensure that implementation is done, not just having very good policies at a national level or at a sub-national level, and yet when it comes to implementation, for example, access to basic healthcare services and facilities for the whole of the population in a country. Some of these were very, very, just things that until today, a lot of developing countries, are really still, grappling with. And so how then do we ensure that implementation of policies, implementation of practice for different systems like education and so forth really happens? And so for us, these are some of the things that we've really been advocating at country level and ensuring of course, that some things like addressing information, the ICT, information communication technology policies, because there's a lot of reliance on issues of technology. There's a lot of remote working. A lot of civil society organizations had to close offices, limited funding, but also limited or restricted movement and things like that. And so there's a lot of now new learnings in terms of how do we work remotely, for example. How do we still cushion or support communities virtually, for example? And I remember we had a lot of innovation to sort of just address that. And for the forum, the SDG Kenya Forum, we found ourselves, in terms of service provision, but also coming up with, analysis and policy, just recommendations, but also deeply involved in terms of just advocating and ensuring that the government, but also the development partners can also just be at par in terms of some of the things that we wanted to see to cushion communities. Also, I believe my second point would be how do we make leaving no one behind a reality? Leaving no one behind a reality, because within the COVID pandemic, it was very, very evident that a lot of populations in developing countries are left behind. Issues of the vaccine uptake, infrastructure to just support vaccines in rural areas. There's a lot of myths. I know I'm sure most of you have heard about communities that don't believe in vaccines or are very skeptical about vaccines, and there's all these myths that are going around that this is not African, or this is not Kenyan, or this is not, whichever country, and a lot of communities have stayed away from these vaccines with a lot of myths that are going around, yeah. And so also the issues of just having well-equipped health facilities. These are things that can ensure that we don't leave anyone behind. And of course, this point is well connected with the issue of my third point, my fourth point in the issue of funding. How then do we ensure that development funding can speak to some of these critical gaps within country level? And some of these things, like in the digital divide, we need investments that speak about infrastructure and also manpower development that can support this for developing countries, and for us not to leave anyone behind. And so there's been great learnings within the COVID-19 pandemic, even now the conversations about rebuilding back better, where countries have had to, of course, maybe plan for elections. Like Kenya right now, there's an upcoming election, and a lot goes on in terms of campaigns, and yet the COVID-19 is still here with us, and bridging of some of this protocol and rules, and ensuring that, and not ensuring that citizens are well catered for. And so how do we ensure that even issues of corruption that we've seen in many developing countries, where COVID has been an opportunity for corruption in some quarters, and also just the vaccine injustices, I think, as Sasha spoke about, has been ongoing in many parts of Africa, but also in other developing countries. How then do we have global solidarity? And I think for me, it's just the call to global solidarity in terms of as different multi-stakeholder partners, how do we ensure that our advocacy, our implementation, our focus areas, and also our priorities moving forward on SDG, the Decade of Action, can speak towards leaving no one behind, can speak about left and marginalized communities, can speak about how then do we build back together? Because again, as you all know, no man is an island. And so COVID-19 has shown us no country is an island. We've all had to rely on one another for just service provision and many other things. Thank you very much. I think I'd leave it at that.
Excellent, Florence. Thank you so much. I really appreciated you emphasizing civic space. The importance of having voices, but also a mechanism for which those voices can do so in a safe and acceptable way, right? We're all looking for ways to broaden that engagement. And I think what I take away from your points is, as we enter a partnership discussion, all of what this panel has been trying to do, who's missing in the conversation? If each of us would ask who's missing, I think we would start to really embrace so many different elements of what partnerships need. And you've done that beautifully today, Florence, by really reminding us how, given the pandemic, it was even more difficult to have those voices heard and going forward. So yeah, really, really appreciate that. Thank you. We do have a few questions from the floor, and we're going to go a few minutes over. I think everyone hopefully can stay with us. And one of them is from Imran Aziz Tunyo, which is a question about climate change. And if you don't mind, Imran, I'm going to take the liberty to expand it to the SDGs, right? So climate change being one of the targets, but maybe I'll start with Anthony and maybe pass to Jenny and any of the other panelists. How do we take the challenge of the pandemic, but still keep the SDGs as the North Star? How do we keep making sure we're moving towards combating climate change and all the other challenges? So Anthony, if you can start us off, and then I'll pass to Jenny and others.
Yes, I think from my perspective, the key thing is to look at the key lessons that we've learned from this pandemic. What this pandemic has taught us is that during normal times, we need to prepare for crisis. And it's the same that we are doing in climate. We are acting as if all these things are going to remain as they are, and yet we know there's a crisis coming because of just the state of how we are managing our climate issues. So mine would be that in these normal times, we need to think about what it will look like in a crisis situation and prepare for it. And I think that will be critical to ensure that when a crisis hits, we are ready for it, as opposed to how we were caught off guard by the COVID-19 situation. And that, I think, is a key for us.
Yeah, I love the idea of taking what was created in this global development emergency and keeping it there, and then looking at the SDGs, right? Looking at global climate action, looking at climate justice, and really trying to now just move the lens where it's most urgently needed. Yeah, I love that, Anthony. Jenny, any reflections on the same point?
Yeah, thank you, Lisa. So if I may, specifically on climate change, of course, the pandemic pushed back COP26 by a year. So we lost that time. So I think temptation is to say, goodness, this is terrible. There's nothing good that we can take from this. But actually, I don't think that is true. I think one thing that this has really helped us with is it has shown people that the climate crisis is a health issue. It's a human health issue. It's not an environmental issue. And COVID is a zoonotic disease. We're connected to the environment. And it was really noticeable actually at COP26 when it took place in November last year, a year delayed, how much presence there was from the health community. So that gives me hope that this is going to be so much better connected now. And then my second point is that we need to make sure that recovery stimulus, economic recovery stimulus, goes into actions that will help us to meet our climate targets, not push us further past them.
Yeah, very good point of looping in, building forward as we go towards net zero, right? So not using or missing the opportunity, right, to now really build back cleaner, greener, better, et cetera. Colleagues on the panel, happy to go to each of you for a final moment before the wrap up. And colleagues, this recording will be available, so there will be, I'm sure on the DESA website, on the ECOSOC Partnership website, all the information will be available. Sandra, would you like to come in, and then I could pass maybe to Emily or others just for a quick moment? Go ahead.
Yeah, sure. And just to appreciate, all of the panelists, and because I think we've all highlighted that, we come at partnerships from very, very many different directions. And just also to respond to the challenge from the civil society lady who spoke after me. I'm sorry, I can't see her name on the screen right now. True, it's apology on that. But, I think perhaps one thing that didn't come out very strongly in our overall discussion is accountability. I mean, you don't enter a partnership without being accountable for what your role is in there, and that needs to be stated up front. So, I think David framed it as being honest and authentic, but with that also comes the accountability. So for sure, we're not calling for wanton engagement of private sector. In fact, one of the things that the Global Compact stands for is accountable companies and principle-led business. So irrespective of who the partners are, I think, even the UN comes with its accountability framework. Government should be accountable for what it delivers in a partnership. And so should all stakeholders if we do want to achieve really effective and efficient partnerships. So I just wanted to really underpin that in terms of a framework for assessing what success should be like. Thanks, Lisa, and really great contributions from everybody.
No, and I think, Sandy, accountability goes with authenticity, right? So if we go all the way back to how we started this event, honesty, humility, authenticity in a partnership means you're coming ready and willing to take on that role that you're now leading on, contributing with, trying to help bring others together with. So I really think it's a great way to echo all these great interventions this morning. Philip, would you like to come in with a quick reflection?
Well, more than a reflection, it's an invitation for Emily and Graham, because I was looking over the report and I see that they have the different sections on a regional base. And I would invite them to actually reach out, and we are happy to contribute so that we have a regional focus and discussion about this, because I believe the findings brings us much further on where we are actually and how we can move forward. So over to you, Lisa, again.
Fantastic. So partnerships happening on the panel for partnerships. Fantastic. Emily and Graham, any reactions to Philip, but also to the panel at large?
Yeah, so thank you, Philip. I think we will follow up, so that's terrific. Graham and I have been really interested in questions of leaving no one behind and those left furthest behind. And so I think we were really interested in comments by kind of Anthony and Jorge and Florence about some of the more kind of on the ground experiences of that and maybe how that's working, but sometimes how it's not working. And also kind of hearing, Jenny sort of framing climate change as a health issue. And again, thinking about that, not just as an environmental issue, but thinking about the kind of breadth of that and how it plugs into other things, I think really resonated. Yeah, thank you.
Excellent, great. Thank you, Emily. Jorge, over to you.
Yeah, just to say we are still challenged by COVID. COVID is not ending. We are probably far to end COVID. So it is important to continue adapting, to continue learning, to continue working together, including all the groups as we can as part of the solution, because the solution it will come from every one of us. So this is my final call for this panel, and thank you so much for the opportunity.
Yeah, excellent. And Florence, would you like to just say a few final words before we wrap up?
Yes, thank you, Lisa. I think mine is just to say that COVID-19 really showcased the great inequalities that exist in the world, talking about global south, global north. And yet we all, we all suffered one way or another when it came to COVID-19. And so there's none of us that, could say that we stayed away from COVID. And so this really shows us that we are indeed one village, and we need to really continuously just support one another in terms of how to achieve development from a bottom-up approach. And for me, that's what really I'm passionate about, and would like for us to have global solidarity towards really understanding the issues that COVID-19 has really showcased, and how do we do that for education system, for health systems, and so forth. Thank you very much.
Fabulous, fabulous. I think that is all of our speakers. And I think at this point, want to just appreciate our esteemed panelists, our presenters, our keynote, Dr. Nabarro. This has definitely been an amazing display of where we are in the world, as COVID, in fact, is not over. And also how, with those lessons learned, with that commitment, with that desire to build trust, we're all really, really reaching out and spreading the word that from local to global, from community to government, we're all seeking partnerships for success. And we will build that trust. We'll make sure that we're inclusive. We'll look to be humble and to be open and to be authentic. And we'll do so in the spirit of the 2030 agenda. We'll do that in the spirit of the Charter of the United Nations. And we'll all do our best to limit the negative impacts and reach for the future. So thank you so much. It's been really a pleasure. I know the Joint SDG Fund would love to meet each and all of the panelists separately as well, because obviously we're hoping for that finance that was brought up as one of the components to partnerships, is that de-risking funding and that blending of finance with partners. So we'll also try to be a tool in your arsenal as we go forward. Thank you so much. Thank you to all of our audience members. Thank you for your sharing in the chat and for the cross-fertilization of web pages and reports and data. There'll be more of this, of course, available on the ECOSOC Partnership Forum page. So please stay connected in that regard. And we look forward to seeing you in those trust building partnerships. So all the best, everyone. Stay healthy. Take care. Thank you.